Hi everyone, Kristina Bauer with the Texas Lyme Alliance. I'm here today with Dr. Wilson, who has treated, how many years?
5,000 patients with Lyme.
Yes.
Okay, over 15 years.
Yes.
Okay.
And then before that, you have 30 years as an
31 years of
OBGYN.
OBGYN, 6,000 babies.
6,000 babies. So
Okay.
I wanted to come out today. It is Lyme Disease Awareness Month. Dr. Wilson is retiring from treating Lyme disease patients. So I wanted to give him a big thank you from the Lyme community. And I got him this beach bag. Thank you very much for all of your service. And no, that's fine. You can keep that to yourself. But just so the Lyme community sees that we do show our gratitude to our doctors, and we so appreciate all of the things that y'all do to get us on the road to health and get us back to work in the home and back to work in the communities, because that's where moms serve their best purpose. So thanks for helping that happen. I was originally your patient in 2012 with Lyme, and I was freshly diagnosed, and he helped me a great deal. So I wanted to turn it over to you and let you talk today about gestational Lyme to the public and how that is diagnosed and some things around that are close to your heart.
Okay, thank you for the introduction.
You're welcome.
Yeah, so been a practicing obstetrician for 31 years. Here's how I got into Lyme.
Okay.
One of my patients that I had delivered a year and a half or 2 years before, she came in walking with a cane. She had dark glasses on and was banging into the walls.
Oh my gosh.
Okay, and I said, "Good Lord, what's wrong with you?" She says, "I have Lyme disease." She had a PICC line in.
Oh wow.
And I said, "What's that?"
Oh no.
I had no idea.
Right.
No idea about that.
Right.
So I talked with her, and then I went and did some research, and I said, "Holy crap.
Yeah.
That's 2 people I saw this week who had those symptoms, my wife, and once we figured out my ex-wife." Yes, this is my ex-wife.
Your wife at the time.
That at the time,
yes.
if one put it that way, that in any event, we were able to get a diagnosis from one person who knew what was going on.
Yeah.
And I went through the same kind of problems trying to get my ex-wife treated with IV antibiotics that everybody else has to go through.
Right.
They were not approved.
Yeah.
Because the diagnosis wasn't correct. You didn't have enough bands on your test, on her test. She had a low CD57, she had the clinicals, but they wouldn't pay for it.
Right.
Okay, so I paid. Fortunately, I had the wherewithal to pay for it.
Right.
But not everybody does.
No.
And while doing that, we figured out, okay, so another variant of autism.
Yeah.
And Asperger's disease. And so I said, okay, all of them must have this. So we tested all of them, and yes, they did. They didn't have the full, you have to have 5 positive in IgG and all that nonsense. They had a couple of bands that were positive, and fortunately I had the best person in the country helping me make the diagnosis, and that was Joseph Barisano.
Yeah.
Okay. Anybody treated, and a little bit of a difficult situation with her family, and she got a lot of resistance about the diagnosis and a lot of resistance about treating during pregnancy.
Very typical, yeah.
So what from her over time was 2 children that have autism.
Okay.
In a different spectrum, but very, very bad situation. And
sorry.
they spent the rest of their trying to get antibiotics into them and trying to get them treated with different experts in the area. So that's that part. Took antibiotics. She took intramuscular penicillin that Dr. Barisano ordered 3 times a week, these shots for 9 months.
Yeah.
She's very tough.
Yeah.
Baby's fine.
That's wonderful.
The second baby's fine. She took amoxicillin for
Good.
the second child. What we know is from early study with this disease, and it's the only one that really makes any sense, is a prospective study.
Okay.
They don't have many prospective studies.
Right.
But the collection of patients were picked up early on in Lyme in this country in the early 80s, okay? So that Dr. Ronald was working with Dr. Jones, Charles Ray Jones, and they wanted to test and see what happened to these children whose moms had Lyme disease. So they found 100 acute cases of Lyme that were picked up. Lyme was picked up in the first part of the pregnancy. So it was known thing, positive labs, et cetera, followed them through. And they were put on high-dose antibiotics, amoxicillin, after using Rocephin. Some of them took Rocephin the entire time. Babesia wasn't even discovered at that time, so there was no way to know about that.
Yeah.
But none of the kids, the 100 children that were followed prospectively, had any problems with antibiotics. So that just tells you that congenital Lyme is real. The studies are horribly pathetic, and I just read a review of all the literature about this.
It's a big problem.
And the studies that come out, we maybe have 50 cases that you can actually draw information from. And so testing is poor, understanding is poor, treatment is lousy, nobody knows what to do, and so they ignore it. This is a clinical diagnosis. My experience has been, as an obstetrician, here's what it looks like.
Yeah.
I'm going to walk through a case with you.
Okay.
Okay, so a woman comes into my office here as a Lyme treatment physician, and I will say to them, when did your symptoms begin? And that was maybe 10 years ago. So are your children, have you had children past that time of the origin of your symptoms?
Okay.
Yes, the answer is yes. Okay, so tell me about if any of those pregnancies, usually the pregnancies do better if you come in ill and you don't know you have Lyme. You feel better in pregnancy.
Yes, I did.
Okay, because the steroids in pregnancy, that's the good news. The bad news, the placenta will lower your white count ability to actually deal with this bacteria.
Okay.
Okay, so people feel good. That's a false feeling.
Right.
Okay, then at the time of delivery, this is how you can tell that there's something going on, and it's probably Lyme, is they crash.
Yeah.
Within a few days.
Yeah, for sure. It's very hard on your body.
Horribly. And that's where everything starts.
Yeah.
Okay, so there's no question about that. And those, we make sure we talk about the kids and what to look for, give them tests. But the point is that the children can have anything from major defects to miscarriages. A lot of the really good studies were done on fetuses that passed away, abortuses, and they did studies on the tissue that found Lyme spirochetes in these fetuses. Right. Okay. Yeah. They found Lyme spirochetes in the placentas. Yeah. Okay. So we know it goes there.
Yeah, there's no way of denying infection from mother to baby. No way of denying it.
And so, and Bartonella and Babesia, they're all bloodborne, and they do pass through. So you have to deal with that. Yeah. But the key is, did you go down the toilet after you delivered your baby, whichever one it was? And that's Lyme. That's what it looks like. And then you really have to follow the kids, because if you think that the adult physicians don't know anything about this, the pediatricians.
It's even worse. Yeah, we experienced that with our kids. Okay. We had an older pediatrician, and he even said one time, I sure hope I'm doing you right with these kids, because he knew he didn't know anything about it. And every time I'd go in, he'd say, it's a virus. Here is an antibiotic. Fill it in a few days if they're not better, and call me. So we finally stopped going there.
Treatment, let's say if I figured out that, okay, this is a new pregnancy, the lab work on this patient is pathetic. She may have one band of 23 or 39 that's specific.
I think I had 5 or 6.
Some people have 4 and they were lucky. But most of the time, it doesn't fit the CDC criteria. Right. This is a clinical diagnosis. You have to have a high index of suspicion as a physician. You have to know what it looks like and what it sounds like.
As a patient and a mom, I am leaning more toward, there are good tests out there. It's just the affordability of them are not are not
Right.
so great. So
Right,
if
but
you
now-
don't, yeah.
Back, I'm just talking about.
Right.
As we went along, we have more specific tests now.
Yeah.
But again, we're still dealing with sampling error.
Right.
So false negatives. So you have to still go on clinical evaluation.
Right.
You have to see patients, know what it looks like. If you're lucky, you get a positive test, that really helps. It really helps because you can get IV care, intravenous medication.
I got the Cadillac service, and my husband just had good insurance, and we paid for it. But we're a very, very fortunate case that I was able to get IV Rocephin and a port. I had a PICC line, but I did antibiotics for probably 3 years on and off, but I did the whole thing. And I've done a lot of integrative medicine after that as well, but
Well, you've done a lot of work afterwards.
7 years treating, 35 years before that, I had gone undiagnosed. So they knew in the early 80s that Lyme was carried on into birth. Back in Newsweek article was written as well to the public, and I think all the time about the medical physicians and hospitalists and internists. They're all reading the same stuff we are. So I just wonder what they think of those things as quackery or what, but it's really the original studies that were going into the 2006 guidelines for Lyme were not so great.
No, they were pathetic.
I'm not a doctor, so I didn't want to call them pathetic, but
Yeah,
they're
what
really,
I'm saying is we
not
didn't
even
have
done in labs.
We didn't have enough information
Right.
to actually have guidelines. 2006, but they did it anyway.
Yeah,
Okay, so prior to 2006, it took, all you had to have was 2 bands. And then after they got together, then it was 5 bands in the IgG, 2 bands in IgM, or you're not positive and you
Right.
don't get treated, you don't get even looked at.
yeah,
Okay, so that was part of the problems. And here, all these people that even get 3 weeks of antibiotics and go on to have symptoms, the failure rate is at least 20 to 30% on that, even in the acute setting,
yeah,
and they're ignored. And so those women go on to have babies, try to have families, and then the next generation gets sick too. So the kids.
that's happened to me. That's why I'm here today as well.
So it just keeps on going until you stop it.
Yeah,
And to stop it, you have to ask the right questions, know what it looks like, and evaluate clinically.
yeah. So all you physicians out there, this is really good free training from Dr. Wilson. He's been in practice 40 years.
Yeah.
So this is how you do it. Look for, he used to say when I first started patient with you, he used to say, if it talks like a duck and quacks like a duck.
It's likely
Probably
to be
a
a
duck.
Yeah. Okay, so, but you actually have to ask the question to find out whether it's quacking or walking. Okay?
Yeah.
And so if you don't ask the right questions and don't know what you're looking for, then you can put that duck into any other flying creature that you want to.
Yeah,
But, so it's very important that physicians clinically know what they're looking for. Part B is you can use antibiotics, oral antibiotics, during pregnancies. And the amoxicillins and azithromycin are Class B drugs in pregnancy. They do not harm the fetus. They're perfectly fine. Doesn't mean that everything's going to be hunky-dory. So you do the PCR testing on a cord blood with IGeneX or whoever, and make sure that we don't have anything going on there. Even that, if it's negative, you have to watch your children.
right.
And if they have trouble growing, if they have trouble meeting their patterns and everything else that they're supposed to, they're
Driving,
lack
of driving, or
if they meet all of the criteria that the pediatrician has for them growing properly and developing. If they don't, you have to put that as part of your differential diagnosis if you're a pediatrician.
yeah,
That should be be part of the differential diagnosis in any complex case, anywhere in any disease process. Rheumatology, orthopedics, I don't care, okay?
Yeah.
There's Lyme in there,
yeah,
and the psychiatrist the same way. So every doctor is seeing these people, but in my profession with obstetrician, it is so vital to stop the thing from going to the next generation.
Yeah.
So getting evaluation, getting treatment, and then watching carefully so that these children, female and male, do not pass this on to their wives,
Yeah.
if they're male, because this can be sexually transmitted.
Right.
That's another
Whole
debate.
video. Yeah.
Yeah, that we won't talk about that not so much, but the point is that congenitally, kids could get affected, and the lab work is pathetic. So being vigilant
Right.
and watching these things as they come through.
Right.
And I keep treating the mom after they deliver.
Yeah.
And if they want to breastfeed, we know that there's been these bacteria found in breast milk
Yeah,
in the
scary.
past.
Yeah,
What does
for
that
sure.
mean? I don't think it's a big issue with the child, but I don't know how they can pass through some of these things through the stomach lining and the gut in a child that hasn't developed a full protection
Immune
of
system.
bacteria.
So it's better to breastfeed than not, it sounds like. If you are in that situation, you
Right.
find yourself,
Well, you make sure that they get bacteria in their stomach.
Right.
So there are some supplements that you can take to start building up a flora
yeah,
in these children to help. But the mother's passive immunity does not help any better than it helps the mom during the pregnancy. Because you don't make enough antibodies.
even
do
the
as well.
colostrum wouldn't be enough, or
Well,
you,
colostrum is a help in a lot of different ways.
Right.
But we're talking about.
so nursing is still better, moms.
I'm not, don't get me wrong.
Yeah.
Yeah, I mean, but
Yeah.
I won't say you're prejudiced. as a
I'm
pregnant.
a little
I
biased.
have never been pregnant, not
Yeah.
even once, so I have to defer
Okay,
to you.
I'll take that deferment.
Okay, so, but it has to be, you have to be wise about this and know
Yeah,
that this
for sure.
bacteria has been around for at least 20 million
Very
years.
smart and
20
cunning.
million years that we know of.
Yeah,
Okay, so it's been working with mammals for that long length of
they
time.
found it in Iceman.
Yeah, that's 5,000 years. They found it in resin, in amber
Yeah.
that was cut up. There was a tick in a 20 millimeter long piece of amber that had a Lyme spirochete in the gut. Okay,
Crazy.
yeah. So anyway,
We know it's there, you can't deny it, must treat it.
we're right. It's not a simple bacteria. It's not simple. It can hide. It has several forms. So you have to be very vigilant and be very suspicious and careful.
Right, and as a mom with 4 congenital Lyme disease patients, it's very expensive. The Cadillac insurance doesn't always last forever, so just educate yourselves, especially before pregnancy, and get yourselves taken care of and treated if you have the hallmark symptoms of crushing fatigue, migrating joint pain, always stomach issues. Neurological stuff, that's always, for chronic, that's always the biggest thing, and that's where I suffered the most.
Right, and it's very difficult. If I may say something
Yes.
right now about the most important thing is to never get a tick bite.
No,
Okay,
yeah,
but you
but-
don't go outside in Texas or anywhere else if you like to camp or walk your kids
Right.
and they run around. They have to be protected. You've got to.
I have bug spray on right now.
You have to anticipate and expect that there's ticks everywhere in Texas that have Lyme. Those studies have been done.
Right, and
Okay.
mosquitoes fly, and they carry it as well.
You want to be suspicious, and
Yeah.
so anything that sucks blood is a
Vector.
potential vector. So you get your permethrin spray, you soak your clothing in advance, or you can buy permethrin clothing online, and that's how you keep them off your body. And then you use the Avon Skin So Soft skin cream.
Skintastic,
Uh,
yeah, there's
But you don't ever let kids go outside without protection.
that's the best.
Prevention.
Prevention is number 1
Yeah.
cure, that's for sure.
And so that's the main thing I have to remind my patients, that you've got to protect yourself.
Yeah, it can always get worse.
Yeah, and you can get reinfected.
Yeah, it's a big part.
And you have no immunity to this, so you can get reinfected every time you get bitten.
Yeah,
And you can reinfect yourself because of the persisting nature of the organisms. Persisters and biofilm and cystic forms, they stay irrespective of the antibiotic that you're using. You have to know what you're doing with it.
That's right.
So
treating kids with congenital Lyme has been pretty difficult. I just wanted to end on that note. You know, there's people that are willing to treat adults, but it's difficult for them to treat children as well. So people need to know where to get resources and help for their families, because if you don't, boy, it can get pretty ugly. One of my kids was in 4 schools by 2nd grade. He just couldn't think, and the expense of this now ongoing is going to be through high school. He needs the accommodations, and so he's in the best place he can possibly be. So you just want to give your kids the best start possible. So start early and taking accountability for how you're feeling before pregnancy, and definitely go that extra mile to, if you have any question about your health and the symptoms that we talked about today, get tested through IGeneX or DNA Connections. You tend to like DNA Connections better, I think, now as of late than...
Well, it's a question of if we can get DNA on these things, nobody can argue about that. Okay, so I don't care who they see after that. It's not a false anything.
Yeah,
so
for
if
sure.
you get the organism there, and you can get your IVs and you can get treatment, and you don't have to argue with infectious disease doctors. Okay,
because it's a direct test.
Because it's a direct test. It's the organism.
So that's why you like it better. I see.
But that doesn't mean a lot of my patients won't get a positive test.
Right.
But it doesn't mean they don't have it. It's a sampling issue.
Right.
Okay? You can't give 15 urine tests over a period of time unless you get $500 each time you do it.
It's $650 now.
Now, excuse me. Okay, it's $650.
Yeah. Well, thanks for joining us today, and thanks, Dr. Wilson, for everything that you've done to help so many families, including my own. You got me back to...
It's a pleasure. We got you to a point.
Yeah, to a good level where I could help take care of my family at home. So take care all, and hope you enjoyed our video.